One second. Good afternoon, John. It's a pleasure meeting you. And I want to thank you for taking the time to give us some feedback and input about the PeriActive rinse.
Right.
If you
Definitely.
can just give us a little background about yourself, your name, your age, where you're
Okay,
from.
sure. Well, I'm John, and I'm living in northern New Jersey, and I'm in my mid 60s, and I had some periodontal issues, and our local dentist recommended this mouthwash, PeriActive, and I started to use it. And before that, whenever I would go for a cleaning, there would always be some blood and all that yucky stuff as they're cleaning, with the scaling and everything. And after, I think it was by the third, I was getting my teeth cleaned every 3 months. And now I'm up to every 4 months. I don't miss going to the dentist one extra time a year, actually, rather not. And there's no blood, there's no soreness of gums. It's been instrumental in taking out all the bacteria, the negative bacteria that um, create all these problems for us, and not only in our gums, but eventually those bacteria can actually attack the organism. So it's really a big deal to avoid uh, periodontal issues and keep your mouth as healthy as possible.
So it's really interesting for you to talk the dental language, which I think is great because you understand that bacteria certainly can pose a problem. There's good bacteria and there's bad bacteria, and
Right.
PeriActive does focus on the bad bacteria, and all products kill both, but PeriActive does a better job killing the negative bacteria. So interesting, that you had that to that feedback. So how long have you been using the PeriActive?
About 3 years.
3 years. Okay.
Right.
And when you started, it was basically some um, areas that were inflamed and bleeding, or was there generalized bleeding as well in your mouth, or was it localized areas?
I think it was more happening in the visits for the doctor, right? So I wasn't really in any discomfort or pain. I didn't have an overall inflamed mouth, but um, I did notice periodically that flossing or whatever would bring up some blood, right?
Mhm.
And all of that stopped by plus 3 months into it, somewhere between 3 and 6 months. All of a sudden, it all became normal again,
Mhm.
for lack of a better term.
Right. Okay.
Okay.
And had you tried other solutions in the past that, you know,
Um,
you were trying to address this issue?
Not, there wasn't really anything to use. The dentist would just have me come every 3 months because he didn't have anything, and then all of a sudden they had this product.
Okay.
So it was reasonably priced. I didn't think like, oh, he's trying to make a killing on me here. Yeah, so I just went ahead and tried it, and just using that, um, it changed my dental hygiene. You know.
Okay. Well, it's always nice when you can, as you said, not have to go as often to the dentist. So, that's certainly a plus.
Hmm.
And, seeing the results that have seen, certainly, it sounds like it's much better than it was prior to using PeriActive.
Oh yeah, absolutely.
Okay. And anything else that you found with it, you're using it twice a day? Is that how the dentist recommended it?
Yeah, yeah. I'm using it twice a day. Um, for me, the most important one to me in my head is at night because I've got, a 6 or 8 hour window where nothing's happening. So I want to guard that pretty well. In the morning, I'm usually pretty, after I brush, use it as well to interrupt the bacteria cycle because they replicate, periodically. And by interrupting them, that keeps my gums healthy,
Okay, great.
Yeah.
So would you, knowing what you know now, would you, and I know you're not a dentist,
No,
would you recommend this to somebody that had bleeding gums or possibly periodontal issues?
absolutely. Yeah. I mean, I can't imagine why you wouldn't want to stop that. It's not only, like we said earlier, it's not only, a dental thing. It's also it's your first biome.
Mhm.
So it's really important that you have shields up for the outside world that's constantly trying to attack, right? Yeah.
Okay, great. So is it fair to say that you're happy with the results and you're a fan of the product?
Yeah, absolutely. Yeah, I wouldn't be talking to you if I wasn't a fan of the product. We have plenty of product in the world that doesn't work. This one works.
Okay, great. Well, as a hygienist myself, I'm always happy to hear when patients have good results. That's always first and foremost when I speak to people, and it just, really um, is where we want to get the patient to see, better
Mhm.
results and keeping that mouth healthy. So. Well, I want to thank you for your time, John. It's been a pleasure speaking to you about the product. And again, I'm very happy that you're seeing good results.
Yeah, thank you, Barbara. Nice meeting you in person. All right, and take care.